Good morning, good afternoon, good evening, everyone from wherever, whichever part of the world you're joining us this day. Thank you for joining us for today's webinar. My name is Olusola F, as some of us do know, and I'm a senior technical advisor for nutrition at Bed Davids International. At Bed Davids International, our hope is for a world of nutrition equity where everyone deserves and gets access to healthy, affordable food and quality nutrition care. Our goal is to make nutrition everybody's business because nutrition is actually everybody's business. So that is why we're excited that on today's webinar, there are not only nutritionists, dietitians, medical professionals, agricultural professionals, homemakers, economists, but also we do have economists, financial planners, customer service professionals, insurance brokers, scientists, lecturers in diverse fields, pastors, teachers, sales professionals, etc. To this effect, we'll be having periodic webinars whereby we continue to discuss nutrition for everyone. And you can find out more information on our website at www.beddavids.com. I'd like to introduce two of my colleagues that are with me today, Dr. Olusola F, who will be handling our question and answer section, and also Dr. Esther Matuku, who will be presenting the results of the survey that was carried out in Kenya. So a few housekeeping rules. All participants are presently on mute, and we kindly ask you to please keep yourself on mute to avoid interference with the speakers per time. Also, we would like you to type your questions in the chat box, and we will answer as many questions as possible at the end of the presentations. We would also like you to note that this webinar is recorded and we are streaming live on our Facebook page. And also on the Facebook page, you can also engage us by typing your comments or questions in the chat box, and they will be attended to at the end of the day. So at this point, I'd like to welcome Dr. Matuku as she presents our results. Thank you.
Thank you. Good afternoon. Good morning, people. Thank you for joining us. I am Dr. Esther from Nairobi. I'll be sharing the results of my study that I looked at. I hope I'm on.
Yes,
can you see my screen?
Yes, we can.
Okay. I want to go to slideshow. Yeah, so I was saying I am Dr. Esther from Machakos University, and I'm presenting some results on a rapid assessment, an online survey that we carried out to just be able to check on the impact of the COVID-19 on food security within Kenya and also in Nigeria. Since Kenya reported our first case on the 12th of March, we have seen an improvement of more of these COVID-19 cases. Right now, our minister is also giving the updates. I see we have 84 new cases. So we have seen a trend increase of the cases within this month of June. And despite the country having instituted control measures to contain the spread, we are still seeing a slight increase in the, not really a slight increase, an increase in the cases that we are reporting within Kenya. We have had movement restrictions, we have had cessations, we have had curfews, we have had partial lockdowns, bans on social gatherings, but this thing is still with us. And it has really grossly affected the food and agriculture systems within our country, and we are seeing more households getting food insecure. This is coming at a time when the Sub-Saharan Africa and Kenya being there are suffering a lot of other issues. There's access to sufficient, safe, nutritious food has been disrupted. We had just come out from the locust outbreaks, we had floods, we had drought before that. So as COVID-19 comes in as a pandemic, then it also now increases our vulnerability to food insecurity. And all of Africa, then we can say that COVID-19 is unfolding against a background of worry levels of hunger and malnourishment. And this now could be worsened by the virus. We know Africa has been kind of food insecure over the years, and now the virus brings more complications to the issues that we are already dealing with as a continent. And according to the World Food Program, then is saying that the coronavirus will see more than 250 million of people in the world suffering acute hunger by the end of the year. This means then now we'll have a lot of problems within our households, both in Africa and throughout the world. How is the COVID-19 affecting the food security? We are seeing a lot of labor shortages due to movement restrictions. Our countries have really invested on manual labor, and people are not able to move from one place to the other. There's disruption of household incomes due to job losses. A lot of companies have closed down. A lot of people are getting less salaries than they were getting, and this is affecting the plate on the table at every household. We also have disruption of food and agriculture systems, both upstream and downstream links of food and agriculture chains. And also we are seeing an impact on the food markets, transport, processing of the foods, such that we are seeing less that is availing to the people in the markets. And so the COVID-19 now then exacerbates the food shortages because of food imports, transportation, agriculture. They have all been now hampered by the combination of lockdowns, travel restrictions, and even physical distancing measures. We cannot be able to import, we cannot be able to export, and those big countries and in sectors that we really rely on imports, then now we have really quite a challenge. This survey was carried out in Kenya from the 9th to the 29th of May. It was an online survey, and it was just aimed at giving a snapshot of the household food security in the wake of the lockdowns, travel restrictions, cessations, and all the measures that had been put in place to contain the spread of COVID-19. It may not really give completely the picture that is on the ground, but it gives a snapshot. It's able to show what are we likely to see in our households, what is really happening. The situation might have changed. 3 weeks down the line, the situation might have changed because this was just at the beginning of the lockdowns and the travel restrictions and cessations and all that. The limitation is that it was online, and maybe it was limited to those people that had internet access. So we may have a lot of people who are more food insecure, who are not able to get to this, but at least it gives us a point to be able to tell where we're coming from as a country. I was able to collect data from 638 households, a majority of them being women, 373, and a majority of them were within the ages of 25 to 44, which is the active populations, and that is likely to be really affected by this because of the loss of jobs. Education levels, strangely, I have a lot of college and university postgraduate people. Could be because of the networks at the academia, the kind of friends you keep, your lifestyle. So I'm getting a lot of people at the college and postgraduate. So I'm saying this is now a middle class kind of a response, getting a response from middle class. And when you look at the household incomes, then you are seeing people are getting over 10,000 USDs, but we still have a few more people who are earning less than 1,000 USDs per day. So those are just the demographics. Respondents by county, the Kenya has a total of 47 counties, and I was able to reach respondents from 43 out of the 47 counties in Kenya. So I missed out on 4 counties that I was not able to get a response from anybody in those 4 counties. But this is quite good. For 3 out of the 47, then you have a feel of what is happening in every county and what we are likely to see. So this is what I'm saying. You see there are 47 counties. I'm trying to go to the next slide. Oh God. And when you look at the first question we asked was to find out where the description of household food intakes since the onset of COVID-19. We wanted to see what is really happening in the family, in the household, since we had now the onset of COVID-19. And when you look at this pie chart, then you are seeing a majority of people, when you look at the blue segments, they had enough to eat, but not always the kind of food that they would have wanted to eat. That means people are eating foods of lesser quality and also quantity than that they expect. When you look at the yellow part, we are saying that 14.9% of the households did not have enough to eat. So we are seeing a lot of food insecurity. We are seeing people are going hungry, people are sleeping hungry. Now, when we look at the 5.2 in the green segment, then we are saying that a few of the households didn't even have enough to eat. And only 26.3% of the respondents then nothing has changed. Their food intakes are just as they were before the beginning of the COVID-19. But when you see a majority of this is around 74% of the respondents, then there's been a change in the intakes in the household. So we are saying that a lot of us, even as much as we are in the middle class, as my respondents show, there's still something that is happening at the household. The households are not able to have enough as they used to have before COVID-19. Then I looked at food availability. We tried to find out was really food available even at the household. As much as the food intakes they are changing, what about the availability? When you look at this graph, when you look at the people who are saying often and sometimes, then these two there are people who are really worried about food. They are worried about what will I place in the table in the next meal. A lot of them, 14, 20, are also saying that they have completely run out of food at one time or the other. They had nothing to be able to give to their family, to their households. And then others were also not eating enough. They are eating, but whatever they are eating is not really enough according to whatever they are supposed to be eating in a day. So you see, the food availability has really been affected within the households, and it's because of the loss of jobs. We have a lot of problems with the agriculture chain links being kind of impacted on. So we have a lot of people now that are really missing out at the household level, that more and more households are getting food insecure. Okay, when you look at the households, we ask households whether they are taking balanced diets, if they could be able to afford a balanced diet. We know that a balanced diet is very, very important for any of the family members, and especially the most vulnerable. We are talking about the young children, we are talking about the aged, the pregnant mothers, and all the members of the household. Because when you are taking a balanced diet, then you are able to provide nutrients to keep your body healthy. And health is important for to support the immune systems. And immunity is very key in COVID-19. We are told that the higher your immunity is, the lower or the lesser the effects that the COVID, in case you get COVID-19, will have against you. The regional director for Africa says that COVID-19 does not treat us equally. And whether or not we have a healthy, nutritionally balanced diet is a key factor on how our bodies respond to the virus. If this virus gets to you when you are not of a good nutrition status, then we are saying you are being more vulnerable. we are seeing the people who have underlying factors, the comorbidities, are the same people that are really dying out of COVID-19. The same applies to the nutrition status. If this virus gets you at a point where your nutrition status is poor, then we are likely to see grave consequences on you as a person once you will get the virus. When you look at the masses, then you are finding that a lot of these people are not able to afford balanced meals. When you look at the red bar, then only 55.6 are saying sometimes they were able to afford a balanced meal. Often that 3.7 and the whole 10% were never at all able to afford a balanced diet. What does this mean? It means that these people now are eating foods that are of a lower quality. It means that the diversity is low, and then it means that most of the foods that are likely to build the immune system are not given. Because when you look at the immune boosters, we are talking about the meats, we are talking about the vegetables, it's most likely that most of these households are not able to afford this kind of foods. So what happens now if the virus is able to get to that person who has a lower immune function, then it means now you will suffer more of the consequences of the virus. Then a lot of families are also now coming up with coping strategies because life has to go on, something has to happen. So what are the coping strategies that the households are using? We are seeing that a lot of households are cutting the size of the meals or even skipping the meals at one point. It's like that you find that a family is serving maybe 1 or 2 meals in a day and skips one of the meals. If they are to serve the whole of the 3 meals, then it means that they also cut the sizes so that now they do not, because they have nothing much at their disposal. Others are eating less. They cut the size, they also eat less, and others are relying on low-cost foods. A lot of households now are going for low-cost foods that they were not really taking as a household. And it's most likely that these low-cost foods, then these are foods that are also not very nutrient dense. And if you are not taking foods that are nutrient dense, then we are saying now that it still goes back to your nutrition status. What will be your nutrition status, and how are you able to cope with the virus in case of any infections? So we are saying that now as the virus continues to leave devastating effects, many people, especially in the developed nations, are now shifting their focus from the effects of the pandemic to the threats now it poses on their daily supply of food. And we have seen this in countries that have had lockdowns. We have seen in countries that have had recessions. You've seen countries where now a lot of the masses are relaxed now. It's like they don't really now care about the virus anymore. They are thinking about what will I put in the family table? And people are going out. They are likely to be infected as they go out. So it means that something is not being done at the household level to be able to cushion these families against the shocks of being in food insecure. And because of that, now they are relaxed, they are going out. We have seen demonstrations, there have been lockdowns. We have seen people going out and demanding for the economies to be open. Because now people are worrying more about food than the virus. That means now, when we see now we are really worried, then it means the stores and all the backup that the families and the households in place have been depleted, and people now have really to go out and get food for their families. And especially in the urban areas, it is, and because majority of the people are working in the informal sectors and they rely on daily cash flow incomes. So it means that they are eating from mouth to mouth. So if I don't get any salaries or any wages today, then tomorrow I will not be able to afford a decent meal or even a meal at all. WHO is recommending to the member states that they should be able to provide assistance to the food secure households. Though I wanted to find out what has the Kenyan government really done against this. When you look at this, we are looking at the food and monetary support, whether the people are getting any support from the government or where they are getting support from. When you look at the food pack support, then a lot of people that say they had food pack support, and only 33 out of the 638 households said that they had support coming from somewhere. And a majority of those, the support was either from their neighbors, their friends, or their relatives, not from the government, not from anybody else. It is just within the family. The kinship ties in Africa are still working. And you see that most of people are just reaching out to their relatives and their families and their neighbors. A few were getting something from the religious bodies, a fewer from non-profit organizations, and very few now from this government, or either at the county or the national level. And yet now, Kenya as a member state is asked by WHO to be able to support food to the households. So is the Kenyan government doing really enough to be able to take care of the masses? That's a question we all need to ask ourselves. When you look at the monetary support, then relatives and neighbors are also still leading the pack in giving monetary support to households. The government here has really improved at 29%, and I think because the Kenyan government started a cash transfer system where they were transferring some monies to food insecure households, but this was targeted mostly at the slum areas, and that's why we are seeing maybe a higher increase than the food pack supports in the previous slides. And then religious bodies, as much as they are also giving a little bit of monetary support to the food secure in secure zones. When we look at the counties that were giving this monetary support, that offered support, then you see only 15 out of the 47 counties among those that we sampled, we got respondents, then were the only counties that were giving any form of support, with Nairobi reading, Machakos, Kisumu downwards. The higher level numbers in Nairobi, Machakos, Kisumu could also be because of the higher respondents from these two areas. Most of the respondents were from Nairobi, Machakos, Kisumu. It could be that's why we see the same strength in this. But then you see, out of the 47, if we are saying the county governments or we are supposed to be taking care of our next door neighbor, then only 15 of the counties we are having people looking out really for their neighbors, or the county government or the religious bodies looking out for their neighbors. Then we also have the counties that offered support. These are 14 out of the 47, then we have only 14 counties that are offering any part of a monetary support. Income, when we asked the respondents if there had been a reduction of the monthly income since the onset of the COVID-19, and a total of 73.8%, almost 74%, that is 3/4 of the respondents, then they say there has been a reduction of the monthly income at the household level, the household level. And we know that now lower household income has been consistently associated with poorer diets. If you, when you look at the poorer households, then the quality, the adequacy, the balance, the variety, the moderation, all the 4 aspects of the nutrition diets, then they are really poor in the households that are poorer. And now, with all these measures that have disrupted the markets and leading to significant income losses for many households, then that's why we are now seeing a really change in the way the households are responding in terms of food security. And now, when you have the risk of food insecurity now, then increases when the money to buy food is limited, because if I have no money to be able to buy the foods, then it means that now my household is likely to be insecure. And if my household is insecure, then it means that I am the person who is not able to offer those balanced diets. I am the person who is now going to come up with coping strategies that I will not be able to give my family a lot of the food that they need, the variety that they need. It's most likely that I am likely to just now really work on the carbohydrates alone, and I will relegate the vitamins and the other nutrient-dense foods, so that at least I have something to offer in the table. So income really is affecting the food choices that we have in the households within Kenya. Then I try to do a relationship between the food availability and income reduction. And for all the households that said that there had been a decrease in the incomes in the households, then when you look at the chart there, the blue bars, then you see often and sometimes a lot of them are worrying about food. The same people who have a reduction are the same people who are really worried about food. That now is qualifying that income is very key when it comes to now the availability of food in the households. They are the same people who are saying that they have also ever run out of food at one point. When you see the combination of those are saying often and sometimes, then they are higher than those who have never at all had an issue with their food availability and reduction of foods. And there's also the same group that is not also eating enough within the families. When I did the cross-tab also and to take a relationship, then you'll find that there's a relationship between also the copy strategies and the income reduction. Still, the households that are answered yes to a reduction in income, then they are the same families that are cutting and or skipping the meals. They are the same side, the same households that are eating less, and they are the same households that are relying on really low-cost foods. So we are saying income is really a key factor when it comes to food security in the households, and especially for most of our respondents, whom we are saying there are people living in the urban areas. They have no farms, and even if they may have no kitchen gardens to be able to supplement whatever they are happening. So we really have to look at measures and try to see how do we now try to make sure that these households are food secure. And now that even WHO now says that COVID-19 is here to stay with us, do we now continue in the downward trend we are seeing in the food insecurity in the households? Something has really to be done. On conclusion, then I'm saying that COVID-19 has had impacts on the food security situation in the Kenyan households. From the data that we collected, we've seen how people are using coping strategies, how there's no food availability. And this is greatly being felt among the urban population, majority of them who are in the informal sectors. And has been evidenced by the remarked decrease in the diet quality for most of households, and also the household mechanisms that we have seen that the families are really trying to come up with. And now within Kenya, we have another extension. We had another 30-day extension of the movement cessation, and the situation might have worsened. As I said before, this was between 9th to 29th of May. Right now we are in June. Something must have happened within, and I'm seeing a possible reaction that most of the households could now be even in a worse situation than when we carried this study, because at this time people still were, salaries were coming in, maybe some people had backups within from the earlier months, because most of the majority of the households had even been prepared for lockdowns. Now, if that was the situation now, then some months down the line, then we are saying that this situation may have worsened. And then we should be able to put in place measures to strengthen the household's ability to withstand the shocks. We can provide now this life and livelihood-saving food and cash-based assistance, just as WHO reports. The government should now be able to step up their measures and be able to look out for the households that are food insecure. And then we can also be able to integrate a systems approach to nutrition in the COVID-19 socioeconomic response. I am not sure what is happening in Nigeria, but in Kenya, you'll find that most of the nutritionists have not really been part of the response, the socioeconomic response. It's like we are still relegated at the back, yet we are the people now who should be able to tell the people what are we supposed to eat, how do we cope with the with the virus. What are the foods that we should be able to take to build our immunity, immune systems, so that if the virus ends up coming to us, then we may not really suffer consequences. But the government still is relegating that, not really much putting the nutrition aspect into the place. And this is something that should be able to really be done, so that we may have everybody now on board from more sectors, so that we work as a collaboration of sectors, from the agriculture, nutrition, health. This is not a health issue only. The practitioners, the doctors and the nurses, this now it needs a multi-sectorial kind of sectors coming together to be able to find out what really happened, because food insecurity then now will make the situation worse than even the virus itself. So thank you for listening to me.
Thank you very much, Dr. Esther. Thank you very much. That was very insightful. Please, just to remind everybody that if we have questions, please put the questions in the chat box. And for those of us on Facebook Live, if you could just put your questions, we will attend to them as much as we can. Immediately after Dr. Sotunde gives her own presentation. So, Dr. Sotunde, over to you, please.
Thank you. And thank you so much, Esther, for laying that background for my presentation as well. So as we all know, today we're discussing this results of this surveys that we carried out in Kenya and Nigeria. And I'll be speaking about what we saw in Nigeria during the survey. So just to add a bit to the background, at the beginning of this year, it was said that 135 million people faced acute food insecurity. And sadly, it's been estimated that by the end of this year, this number will have increased to about 265 million. Like we've all known, COVID-19 has been a major disruptor of food systems, health systems, social systems, and even economic systems. So a lot of us on this platform today are aware of this modified UNICEF conceptual framework, but it is important to still state it that, as we all know, inadequate dietary intake and diseases are actually the immediate causes of malnutrition. However, one of the main underlying causes of malnutrition is food insecurity. And malnutrition is the most serious consequence of food insecurity as we know it as of today. So whether we access food security in Nigerian households during the COVID-19 pandemic, especially during the lockdown and during the country actually had a couple of the states to be on lockdown. So I don't know why my slide has decided not to move on. We'll just a minute and see what's going on here. So we sourced, for this survey, we sourced that data from self-reported online survey. And like Dr. Matuku said, this might also be one of the limitations. However, we were not planning to assume anything that people that have access to internet are actually food secure, because researchers showed that that is not always the case, especially even if you're living in a low or middle income economy. So we used the modified, we used the Canadian Community Health Survey food security questionnaires. This study was carried out between May 7 and 29, 2020 in Nigeria, and the sample size was 799 individuals from 799 households. Majority of our participants were between the ages of 25 and 44 years old. That is about more than 80% of our participants. And 60% of the people that responded to this survey were females. They were a highly educated group of people, with 96% of them having a university degree or a postgraduate degree. When we looked at, when we checked to see if there were differences in gender differences in education, we saw that more women had a postgraduate degree compared to the men that responded in this survey. The average household size of this survey was 5, but meaning that five people per house. And we were fortunate to have all the geopolitical zones in Nigeria represented in the survey. So we had people from North Central, Northeast, Northwest, and out of the whole of Nigeria, out of the 36 states and the Federal Capital Territory, was only 4 states that we did not have any respondents. And also 41% of the people that responded to this survey actually live in Lagos State. And Lagos, at this time that this survey was carried out, was actually on lockdown. So a lot of people were not going out. There were laws in place for people to stay at home, and we had over 41% of our respondents from there. Just a minute, I seem to have frozen again. Okay. We also asked about the household income of respondents, and 24% were earning less than 50,000 naira. And we could see about 44% actually earning less than 75,000 naira per month. It's been said that the average household income in Nigeria is between 75,000 and 100,000. And we could see that it was only 15% of the people that responded to this survey that said they were earning between 75 and 100,000. Some were actually earning more than that. During this period, when we asked if the income had reduced since the global pandemic of COVID-19, and 70% of our respondents actually responded in the affirmative that their income had actually reduced during this period. So looking at the food security questions that we asked, specifically the first one, when we asked which of the following statement best describes the food eaten in your household since the onset of COVID-19 pandemic, almost 80%, so about 79.9% actually had varied responses about how this has impacted their lives. And only about 21.1% actually said they and other household members always had enough of the kind of foods they wanted to eat. When asked if any household, the respondents and any other household member actually worried that food will run out before they got money to buy more, 34% said often this was the case. This is quite high. 46% said sometimes. So this means about 80% of the people actually worried that food will run out before they got money to buy more. When asked if food did actually run out during this period, it was only 43% that said food did not run out. So that means 57% of the respondents actually ran out of food at one time or the other during the lockdown. We asked if they or members of the household could afford to eat balanced meal. And only 36% that said yes, they could afford to eat balanced meal, meaning over here again, we have over 64% that says that they could not afford to eat balanced meal. And like Dr. Esther rightly discussed about how this is important, especially during this period. And then seeing this high percentage of people from our respondents who are middle class, who are highly educated, still saying they could not afford to eat balanced meal during this period is quite concerning. When we ask questions about if they ever relied on, the adults in the household ever relied on only a few kind of low-cost food to feed the children because they were running out of money to buy food, 15% of our respondents, this was not applicable to them because there were no children in the household. But of those that responded in the affirmative, sometimes 48% said sometimes they had to rely on only a few kind of low-cost food to feed the children. This is also quite concerning. 24% said often they had to do this. When we asked if the children were not eating enough because adults in the household just couldn't afford enough food. Out of all those that responded in the affirmative, 15% said this was often the case, 37% said this was sometimes the case. If the adults in the house ever cut on the size of their meals or had to skip meals because there wasn't enough money to buy food, this was another concerning statistics, as about 27% said this was often the case and 38% said this was sometimes the case. If people ever personally ate less than they felt they should because there wasn't enough money to buy food, we can see also how 42% said sometimes this was the case with them, 25% said often this was the case. When we asked if our respondents were ever personally hungry, but didn't eat because they couldn't afford enough food. 41% said yes. So we looked at to see if there was any relationship between the gender and food security in respondents, and there were no relationships between gender and food security. And this is this is not surprising, because we could see in this case of those that responded, 60% of the women, out of 60% of the women, majority of them have about 90% of them had a university degree, or even some of them, about 44% of them, in a postgraduate degree. So this means this was a highly educated group of people, so there might be no gender difference. However, income played a major role with food security in our respondents, as we've known, as we expected. At the same time, it is a bit worrisome to see the figures. So when we look at people that have been, the people that we've said this is the average income in the country between 75,000 and 100,000. And we have as high as 53.6% saying they and other household members had enough to eat, but not always the kind of food they wanted to eat. This is quite concerning. Not to even talk about the people, the 52.1% of those who were earning less than 50,000 naira a month as household income, saying sometimes they and other household members did not have enough to eat, which shows that a high percentage of respondents were actually food insecure. When we asked if they were worried that food will run out before they get enough money to buy more, and we look at it across the different income strata, we could also see this figure, this concerning results as well. Focusing more on the 75 to 100,000 income earners per month, but we can see how those that are earning as high as 40,000, 450,000 naira a month, we seem to have less of these people having this problem. So 38% of the people that are the average income earners in Nigeria were worried that food would run out before they got enough money to buy more. And 22% of these people food actually ran out and there was no money to buy more. We asked if they could afford to eat balanced meal, like we've said. 20% of those in the 75 to 100,000 says often they could. 71% said sometimes. So that means at one point or the other, they couldn't afford to eat balanced meal. We asked if they ever relied on few low-cost food to feed the children because they're running out of money to buy food. And we could see here, the lower the income, the higher the food insecurity. We asked if the children were not eating enough because adults could not afford enough food. And we could see 32%, about 33% of those that were earning less than 50,000, and they had children because it's not, and they had children in the household. About 33% of them were saying the children were not eating enough because the adults could not afford enough food. When we asked if they themselves or other adults had to cut the size or skip their meals because there wasn't enough money for food, the picture is also the same here. When we look at those that are earning, even those that are earning 150,000, between 150,000 to 299,000 a month, about 7% of them were still saying that they had to cut the size of their food or skip meals. So these are the coping strategies that we were talking about. Where we asked if they ever ate less than they should because there wasn't enough money to buy food. 23% in those that were earning 75,000 to 100,000 said yes, they had to eat, they ate less because there was not enough money to buy food. 51% of those that were earning less than 50,000 said they actually did eat less because they know that there was not enough money to buy food. When asked if they were hungry but didn't eat because they couldn't afford enough food, yeah, the picture is as glaring as it is. We can see how the graph changes across the income level. So there were social safety nets that we asked the questions about this. Did you or any member of your household get any food pack support during the COVID-19 pandemic lockdown? 23% of the people, of the respondents said yes, they did get food pack support. And when asked where did they get them from, about 36% said they got them from religious bodies. 31% got them from neighbors, friends, or relatives, which, like Dr. Esther said earlier, that we really look out for one another because we know that at times the government doesn't get to do much. In this case, we got 7.6% of the people that actually got food pack support from the government. And this also speaks to the fact that this was the time that they were rolling it out initially. And also this might not have gotten to this group of people, because if the government does not see them as a vulnerable people, then they might not get it, knowing fully well that these are people that have access to internet, like we said. When we asked if they got any monetary support during this lockdown, same 23%, 23% also said yes, while 77% said no. And where did they get this support from? Majority, about 68%, was from neighbors, friends, or relatives. And this also, the government just recently released that they will be sending money into the accounts of the vulnerable. And maybe this is why it was only one person here that said it got the support from the government. However, this might also mean it might not be targeted at this group of people whom we've all assumed that they are food secure, because they live majorly in the cities. They have access to internet. They are educated, highly educated, but doesn't necessarily mean that that is the case. So in conclusion, 4 out of 5 people actually worried that food will run out before they will get money to buy more. A little less than 3 out of 5 people did run out of food at some point with no money to buy more. 3 out of 4 people at some point relied on only a few low-cost food to feed their children because they were running out of money to buy food. A little more than 1 out of 2 people at some point said the children were not eating enough because they and other adult members of the household just couldn't afford enough food. 3 out of 5 people could not afford to eat balanced meal at a point during the lockdown. A little more than 3 out of 5 people cut down the size of their meals or skipped their meals at some point because there wasn't enough money for food. A little more than 3 out of 5 people ate less than they felt they should because there was not enough money to buy food. A little more than 2 out of 5 people did feel hungry but didn't eat because they couldn't afford enough food. So what is the way forward? We've painted this, what seems like these grim pictures and all, but what can we do? So just 2 months ago, the Federal Ministry of Health in Nigeria released the Food and Nutrition Response Plan, and with the overall objective of ensuring the integration of nutrition into the national COVID-19 response plan. So this seems to be a good idea, and they have several objectives to this. So I'm going to only speak of the first one, which says that the plan was to offer strategies to ensure the continuity of critical nutrition interventions to vulnerable populations during the pandemic. So my call out to all of us that are on this webinar is also to lend our voices to this, because the vulnerable population are not necessarily people that we, just the people that we think they are. Even your next door neighbor might actually be one of those vulnerable that fall into this. Recently, just this month, the United Nations released the policy brief on the impact of COVID-19 on food security and nutrition. And they highlighted 3 priority actions, which was 1, to mobilize to save lives and livelihood, focusing attentions where the risk is most acute, talking about the vulnerable people again. Strengthening social protection systems for nutrition. This is something that we've seen, that the people rose up to the occasion and became the social safety nets for their next door neighbors, for their friends, for families, for relatives and all, and we keep doing this. Then also investing in a sustainable future. Like I said at the beginning, that our vision at one of our goals at Beth Davids International is to make sure that nutrition becomes everybody's business, because nutrition is everybody's business. In whatever way you can do more, whatever way you can lend your voices to the government, whatever way you can help people, let us continue to invest in a sustainable future. Because having done all, there is a saying in my place where I come from, and it says that tebi bati kuro ninu ishe ti bushe, meaning once hunger is out of poverty, then the level of poverty has been reduced. So as much as we can, we continue to help our people, and at the same time, we continue to hold our governments accountable to making sure that we support the people that are vulnerable in our population. Thank you.
Hey, thank you very much, Dr. Olusola. Thank you for that. Okay, so we have a few questions, and I'll start with Dr. Esther, if you don't mind, please. Two people have asked that of the people that you said that helped to well, make the situation a bit better. They asked that were private sectors involved in helping to create palliative solutions, and then one of them has asked that was the NGO involved in any way, especially in this kind of study.
Thank you. On the first one, the private sector, you see, in the survey, we had given an option on for anybody to give whoever had really given any support. But you see, most of the respondents are either saying it's the church, it's us, and nobody is talking really about the private sector. As much as we have seen a few companies saying that they are giving out food packs, they are giving out, especially the food packs. I'll go with what Dr. Sola is saying. It could be, you see, our kind of respondents are people who are now educated, they have jobs, and we are making the presumption that because they are educated and they have jobs, they are not food insecure, and nobody comes to their aid. Nobody is thinking about giving in food packs to them, about man support. All the energies maybe are being directed to people living in the informal sectors, in the slums. We have seen a lot of efforts have been going to the slums. But then we are saying here is a survey that is saying even these people that you think that have incomes are also getting food insecure. So can the governments now and the private sector and the churches and the friends and neighbors shift their focus also to this other kind of group that we think that they are food secure, and what is happening is actually not what we think. Because someone would think because someone is earning a salary, they're okay. How many mouths are they feeding? They may not be really okay as people just assume. The NGOs, we did not have any NGO involved within the survey. These were just personal initiatives to just see as a nutritionist what is really happening, to the masses. Can I be able to go out and try get data, and then this data is now given out to policymakers, to everybody who is there out, and tell them, okay guys, look, this is what is happening, and maybe this is not what, well, we are not doing anything, and this is what's happening. So there was no NGO. These were just personal initiatives to be able to try and see what is really happening within our midst.
Okay, thank you. Same to you. I'm going to ask you this another question, Dr. Esther. And the person said, with the inter-county lockdown, did you carry out the survey in 47 counties? It was more of an online survey, wasn't it? It was an online survey, yeah. And the person wants to know that was the method of, asking these questions. How did you verify it? I think the person is just trying to know the validation of the on online questioning, online survey, and I think I can answer that. Because there are so many studies that have told us that online surveys are quite valid. They're quite reliable ways of asking questions. Just that sometimes we are limiting our responses to those who have access to the internet. Yeah. That's the only minus to online surveys such as this. Okay, Dr. Shola, someone has asked a very interesting question, which I was going to ask myself. The person said that, did you give your respondents the definition of balanced diet? Was there a general definition of balance?
What a balanced diet is.
Yes.
Okay, so thank you so much to the person that asked that question. Like I said when we were presenting, this was we used for this survey questions that have been validated from the Canadian Community Health Survey, which has been used worldwide. So not just used in Canada, it's been used in developing and also developed nation. And one of those questions was, do you eat balanced diets? And in this case, we're saying during. So in this way, it was not to test the knowledge of the respondents. if they actually do understand what balanced diet is. But it's to say, like we're saying, it could be a limitation, it could be a strength, because you don't want to preempt what this person's response will be. So it is to state as the person understands it. So which is even like the would we say for the barest minimum for someone that doesn't have, let's say for someone that doesn't have nutrition training at the university level. But then also our role and our advocacy role as nutritionists worldwide is to make sure that as many people as possible have a bit of understanding of what a balanced diet should entail. So even though we did not ask, we did not define what a balanced diet is to them, we did ask the question. As it's been validated, it's been used over time.
Okay, all right, thank you. I observed that there was some information that you had in yours that Dr. Esther didn't have in hers actually. So
Okay.
somebody has asked that did you both use the same questionnaire in both countries?
Yes, we did. So we used the same questionnaires. However, we changed the questions that has to do with the income and also the countries, the counties. So for Kenya, it was counties. For Nigeria, it was states. So it's just there are so many ways to present the results from the survey, and for this purpose, each of us had to think of what would be the most, because we have limited time. So what would be the most important thing I want the people to go away with from this presentation?
Okay, all right. And then both of you, another question, which is another good one. Somebody is asking that did you by any chance calculate the prevalence of insecurity in each of your countries during this period? I then want to add that do you think the prevalence of insecurity in this period, I think Dr. Esther hinted on it though, do you think the prevalence of insecurity in this period is higher in this country compared to before COVID-19? Both of you now.
Okay, should I go first? Oh, so it's a known fact that food insecurity in each country, and it's not just in the countries that were presented today, it has increased. Like if you remember my first introduction slide, that was by an organization that showed that at the beginning of this year, so in January, for instance,
The number of
food
people that were
insecurity
undernourished
was
in
about
the country.
135 million people were food insecure. But it's already projected by the end of this year, that's going to be about 265 million. It has increased. I did not calculate for the nation because I don't have, it's not that, it's representative of the nation because we had respondents from about 32 states. However, we don't have equal amounts of people from the states. So, yeah. Esther, anything addition you would like to add, Doctor?
Yeah. I'll just say, so like saying, when you look at our background data, then we are saying Africa has always been food insecure. And we are saying that we are even coming from a point where we had locust outbreaks, locusts eating up the foods. We had floods, we had abnormal rains within most of parts of the Africa, and that means most of the plant crops were destroyed, and people were getting food insecure. We do not also now try to calculate what are the prevalence rates and look at it at what are the prevalence rates within the country, the beginning of the year. But we just wanted, as I said, to just give a snapshot. What is really happening? And you can see that people are getting food insecure because of now COVID-19. COVID-19 is coming on top at a time when we have even had other issues already depressing the household incomes and the household food security. And then now it comes as an addition. And then now we are seeing a lot of food insecure. And when you see what the WFP is saying, they are saying, just as Sola says, at the end of the year, then we are likely to see 250 million of people being food insecure within the whole of the continent, the whole of the world, not even in Africa only. So already we were in a point where we were food insecure, but now COVID-19 is coming and worsening up things.
Making it worse. Thank you to both our speakers. Time is now up. We're now 1 hour. Do you have any last words for us, Dr. Esther? Let me start with you. Last word summary.
Yes, maybe for me, the take home message is that most of the households are really getting food insecure, even as we think that they are not really food insecure. We have seen within our presentations that these are households that are people who have an income, but the incomes have really been depressed because of the loss of jobs, because of the loss of the incomes. People are working now on half salaries. So really the masses are getting food insecure. For me, it's the government to be able to look at measures that they will be able to try and address this issue, because we know once we get into issues of malnutrition for the whole of the populations, then it becomes quite worse, because if these people get this disease with a depressed immune system and when they are of a poor nutrition status, then we are likely to see COVID-19 really now having enough challenges, bringing enough challenges to Kenya and to Africa as a whole. So as people, then we are saying, even I and you, whether in nutrition or not, what can I be able to do, even at the household level? How many of us have kitchen gardens? How many of us have ways to be able even to try and do things differently, even as we see the agriculture systems being curtailed because of lack of labor, because of the stations? We are not able to get maybe a lot of foodstuffs from the countrysides where the foodstuffs are coming from to the towns and all that. So we are really saying it's time, even as people, then we try to come up with the ways to be able to make our households food insecure. To the research community, then we are saying, for us researchers, then what are we doing? Are we just sitting down with the lockdowns and waiting for the lockdowns to end? Are we
Oh,
able to, because if there are cessations of movement, then you are not likely to go out with a questionnaire and get the most vulnerable. Then we should be able to even look at ways, other ways, creative ways, to be able to see what are these the prevalences of these food insecure people. How can we help even those who have no internet access? Can we start maybe calling them and having the questionnaires answered? We have to look for innovative ways, because we are living in abnormal ways, in abnormal days. Then we are saying that we should also act abnormally and try to get this data with whatever ways we are able to do it. Thank you.
thank you very much. But Dr. Shosude, I need to quickly read this before you give us your last words. And it says, by somebody here too, it says it is also important to point out that the reason for food insecurity during this COVID-19 pandemic, or the restrictions among the groups, should not be limited to income only, because there are things like lack of availability, there is lack of access to the markets to actually buy there is fear, there is panic purchase, there is a lack of transportation and things like that. So even though income has played a very significant role, there are these other factors that we need to consider, and people want to know, will the slides be available for everybody to have access to? So I hand over to Dr. Shotunde now, please.
Thank you so much. Thank you so much to everyone. Thank you, Dr. Olusola and Dr. Matuku. And I can see a couple of all our colleagues and friends and families as well. So to answer if the presentations will be shared, yes. So we're going to share the video and also the PDF of the presentations as they were presented today will be shared to as many people that registered. And for my last word, and thank you for that insightful comment about so many other things that actually affect food insecurity, especially during this period. And this is my last word. Everyone on this call, we are to become nutrition allies. What does this mean? As much as possible, support someone nutritionally. We cannot overemphasize the effect, and we saw how people's support of one another has actually carried people through in this period. In a way, not to, because I can see some of my South African colleagues not to say it wrongly, Ubuntu, I believe it's called Ubuntu. Let us continue in that spirit and continue to make nutrition, invest in nutrition, continue to make nutrition highlighted and have major we continue to bring it to the forefront, especially with our government, to continue to let them see how important it is to invest in nutrition, invest in the health of the people, even via their nutritional status. Thank you so much for joining us on this webinar today. I really appreciate you for your time and for your insightful comments. Thank you. Until we see you again next month, hopefully. Take care. Bye.